All right, I'm gonna scan the room. I'm gonna make sure we're in the frame.
I would lower it down a little.
Lower it. Okay.
There we go. That way you can see.
Yeah. Okay. Right. Come in. All right. I'm gonna provide my patient some privacy. Hi, my name is Alexandra. I am a registered nursing student at Northwestern State University, and I'm going to be a part of your care team today, if that's okay with you.
Yes.
All right, can I go ahead and get you to verify your name and date of birth?
Jaden Holzenbeck, 11/11/2004.
All right, today I'm going to be doing a physical assessment on you. It's just a head-to-toe assessment, and since your vital signs were already obtained, we can go ahead and just get started.
Perfect.
All right, what brought you into the hospital today?
Knee pain.
Oh, I'm sorry to hear about that. Has it affected your sleeping schedule or your eating pattern at all? All right, that's perfect. I'm gonna go ahead and ask some questions just to make sure that you're completely alert.
Okay.
Do you know where you are?
The hospital.
All right, and do you know what year it is?
2025.
Perfect. And do you know who our president is?
Trump.
All right, that's great. So my patient is awake, alert, and oriented times 4. I'm gonna go ahead and ask you some specific questions about your pain.
Okay.
So when did it start?
About 2 days ago.
And using one finger, can you point where the pain exactly is?
Right here.
All right, and is it constant or does it come and go?
Constant.
All right, and what are some of the characteristics? Like, is it throbbing, stabbing, what kind of pain?
Sharp.
Okay, and is there anything that aggravates it, makes it worse?
Walking.
All right, and does it radiate?
No.
Okay, and did you take anything at home for it? All right, and on a scale of 1 to 10, how is your pain?
Probably like a 3.
Okay, I'm gonna go ahead and start the assessment so we can go ahead and start with your eyes. I'm gonna hold up some numbers and you just tell me how many you see.
3.
All right, perfect. I'm gonna go ahead and grab my pen light, if I can find it, and just go ahead and focus straight ahead, and I'm just gonna shine my light in your eyes. Perfect. And now just keep focusing on the distant object, and when I say to focus on my pen, go ahead and do so. All right, focus on the pen. Perfect. And now keep your head completely straight and just follow my pen with your eyes.
Okay.
All right, perfect. So my patient's pupils are equal, round, reactive to light, show signs of accommodation, and no signs of ptosis. I'm gonna go ahead and move down to your mouth now.
Okay.
So your lips are looking pink and moist, which is perfect. And now I'm gonna look inside your mouth. So go ahead and say ah for me. All right. Your uvula moves, your palate rises symmetrically, your gag reflex is intact. I don't see any lesions, dentations, ulcers. Excuse me. It's pink and moist. Can I get you to clench your teeth, smile, puff out your cheeks, raise your eyebrows, stick out your tongue, move it side to side? Have you had any trouble swallowing lately?
No.
All right, and although it seems you can hear me fine, do you have any difficulty hearing?
No.
All right, perfect. I'm gonna go ahead and provide some resistance. If you can go ahead and shrug your shoulders. All right, I'm gonna place my hand on your face and just turn it. All right, and now this side. Perfect. All right, and now we're gonna go ahead and get started with your lung assessment. So I can see that your chest is rising and falling symmetrically, and it looks like your respirations are even and unlabored. I'm gonna go ahead and clean off my stethoscope before we begin. All right, now if I can just have you take some deep breaths. Perfect. Okay, now I'm gonna go ahead and sit you up and go ahead and give yourself a big bear hug and take your chin to your chest. I'm gonna go ahead and move your hair out of the way and just do some deep breaths back here as well. Perfect. And now if you could put your hands above your head so I can listen to the sides of your lungs. Perfect. Amazing. You can go ahead and lay back down. I'm going to go ahead and now listen to your heart. So I'm going to start on your right side, and this is your aortic, and it's in the second intercostal space. I'm going to go over to the left side, second intercostal space, for your pulmonic, your left side, third intercostal space for your herbs, your left side, fourth intercostal space for your tricuspid, and then your left side, fifth intercostal space, midclavicular line for your mitral. Your S1 and S2 sounds were distinct, and your your rhythm was regular. And now I'm gonna go ahead and start assessing your abdomen. So I'm gonna lay you completely flat. When was your last bowel movement?
Today.
Okay, and do you have to use the restroom before I begin?
No.
All right, perfect. I'm gonna start with just inspecting, and I can see that your stomach is flat. You don't have any open wounds, any lesions, or any scarring, so that looks great. Now I'm gonna go ahead and assess for a hernia. If you can tuck your chin to your chest. No signs of a hernia, perfect. I'm gonna go ahead and now listen. I'm gonna start in your right lower quadrant, your right upper quadrant, left upper quadrant, left lower quadrant. I heard active bowel sounds, which is anywhere between 5 and 35 per minute. I'm gonna go ahead and now percuss in the same order. So the right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. I heard tympany, so all is well. I'm gonna go ahead and now palpate in the right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. I'm also palpating for any temperature, tenderness, and any moisture. So I'm gonna now go ahead and move on to your extremities and your skin. So I'll start with your upper extremities. I'm gonna use the backs of my hands to check for temperature, moisture, tenderness. I'm gonna poke you to check for any edema. I'm going to pinch up your skin to check for skin turgor. I'm gonna check your pulse, your radial pulse on each side. So they're bilaterally equal. They are a +2 in quality. They are a regular rhythm and about 70 beats per minute. I'm gonna go ahead and now assess your cap refill, one on each hand. That's within 2 to 3 seconds, so that's perfect. And if you can go ahead and squeeze my fingers so I can test your strength, that's equal. Okay, now I'm gonna go ahead and move down to your lower extremities. Using the back of my hands again, I'm gonna check for temperature, tenderness, moisture. I'm gonna poke you, check you for edema. I'm going to go ahead and check your pedal pulse, and it is bilaterally equal, +2 in strength, regular rhythm, about 70 beats per minute. I'm gonna check cap refill, one on each toe, or one on each foot. I'm gonna have you flex towards your head, push your feet towards your head, now press the gas pedals. Perfect. And I'm also gonna check your skin color to make sure it's appropriate with your ethnicity, which it is. And now I'm gonna go ahead and check the back of you, so I'm gonna roll you towards me. I'm gonna go ahead and help you. All right, I'm gonna check your head, your scalp, all looks good. Your scapula looks good, your back, your coccyx, everything looks great. Down to your legs, your heels, everything looks perfect. I'm gonna go ahead and roll you back over, and I'm gonna put your side rail up. I'm gonna bring your bed to the lowest position. I'm gonna put the call bell within reach. I'm going to ask you if you have to use the restroom.
No.
Okay, and I'm gonna go ahead and put you in a comfortable position, so go ahead and just let me know when to stop.
Okay. That's good.
All right, I'm gonna bring your things in close proximity to you. I'm gonna check on your pain. Has your pain changed at all?
Mm-mm.
All right, and I'm gonna go ahead and check all your IVs, your catheters, and everything else. Make sure nothing is kinked. everything is comfortable for you. And I'm gonna go ahead and go check and see if we can get you some medication for your pain. Thank you so much for letting me do my physical assessment on you.
Perfect. Thank you.
Yeah.